start. We'll bring the Health Committee meeting to order February 4th, 2020 at 9 a.m. Would you take the roll, please?
Whitlow.
Here.
Curtis.
Yes.
Barr.
Here.
Pokenauer.
Present.
Doobie. Here. Awful.
Here. Okay, could I have a motion to approve the agenda?
So moved.
Second,
Second.
any discussion? Okay, all in favor, say aye.
Aye.
Opposed? Okay, and then we have the claims, if you'd like to look those over, please, and remember, it's just for the animal. Okay, are we ready? I have a motion to approve the claims.
So moved.
Second,
I'll second
any discussion? Yes.
Yes, this is for Dr. Yusuf on the second. I guess it's the first dog. Short hair. And we have this Telzal or dexdometer, butanol,
it. Do you mind if I sit down here so I can?
Yeah. $160.45. And then cremation, so
Right. So we don't charge this, 160 is the price of the whole thing, the 10 mLs, but we use only one, and this is the big challenge I want to talk today about cats. So dogs, we can sedate them with the tablets, isoflurane. Cats, you can hide the tablets inside the food and
oh,
offer it
this
to them.
is, okay, this is a cat, okay.
This is the cat, and the cat we have to hit her with an injection in the back end here because they're very aggressive.
Yeah.
We cannot approach them. So what usually happens is that one of the animal officer will hold the cat with the rabies pole, and then they have to go behind and then hit it very quick. There is no way to give her tablets because you cannot hide tablets in food, and this is the big challenge for the animal officer and myself.
Was this, okay,
Yeah, so it's different. And isoflurane is not used for
in other
cats.
words, you anesthetized her and then you cremated her, is that-
Yeah, because even Tirazole, the one we use for cats, we have to go with the high dose because we give it
Okay.
intramuscular.
Yeah.
We usually give it IV,
Yeah.
but we cannot approach the cat, I cannot, the animal officer cannot hold the leg to show me the vein and because she's biting and she's scratching,
Okay, so in other words, it was
yeah.
an unfriendly cat.
Oh, yeah, I know, unfriendly, yeah, unfortunately.
Calling for my life too.
Yeah. Maybe you better get some.
Yeah, we picked up cats from January 1st. We have to pick up cats, unfortunately.
Maybe we ought to make a motion to get them some welder's gloves though.
So was this a feral cat or?
disease or what?
Absolutely, absolutely. Like, like if the cat carry fleas, which usually in the stray cats carry fleas, if they scratch you with the nails, usually can cause abortionellosis for human, you can have fever, it's a bacterial infection. And the bite, even, let's say you have two cases, one dog's bite, one cat's bite, if you go to the emergency, usually the physician will give antibiotic for the guy who got bitten by a cat, not by the dog.
Yeah.
You have very nasty bacteria inside the mouth.
Oh.
Yeah, so
Okay.
this is the big challenge for us.
Yeah.
And the other big challenge is how to move them out of the clinic.
Yeah.
The dogs, we have shelter already, very interested about the, county dogs. We
Yeah.
usually, move them fast, but the cats, this is the big deal.
Okay,
Thank you, Doctor.
Sure.
thank you very much.
Any more questions or discussion?
Yeah, I have a question. So in other words, that just to take care of that one cat was $235 because you got euphemism in there and then you got
Right.
cremation, correct? So just that one cat cost us
Right, this
$235.
cat specifically was hit by a car, and they found it in the.
Right. I'm just asking, that's
Yeah.
what it costs.
Mhm.
Wow.
Yeah, so might have a lot more of those.
So a quarter of this drug that you used is $160?
Mhm.
That's a quarter of it.
Mhm.
No, 2407.
24 is the,
The total cost for that cat was 10407,
right.
I believe.
Mhm.
No, because if you had 160.
No, you
No,
don't
no,
add,
no.
that would be for the whole thing. And out of the 160, he used
That's
2407
what I
to
just
put down
asked.
that
So
cat.
that's not a quarter of it.
No, the quarter is the 2407.
That's what I thought.
I'm sorry.
Okay. That sounds a little.
Yeah, so 10407 total.
Gotcha. Thank you very
Yeah.
much, man. Appreciate it.
You're welcome, sir. I'm glad. Because I knew where you were going. You know.
Do you mind if I elaborate a little bit? So unfortunately, in 2019, a big study, they found cats carry more rabies than dogs. Before 2017, 16, usually dogs carry more rabies virus. They can infect human by biting and stuff like that. 2019, cats more than dogs now. Yeah. So that's another thing, like I said, we have to be very careful that nobody gets bitten because of the liability and
And that's due to the bat population, because the cats are catching the bats
yeah,
that are rabid,
absolutely.
not the dogs, the cats are catching them.
Raising bats.
What a nice. All right, any more discussion or questions?
And I just asked Dee, by the way, just a few minutes ago about, because in China, the coronavirus
Yeah.
can be transmitted from bats and cats. And I asked her today, she said no reported cases yet, that, from bats and cats to human here in the States
Good.
so far. So it's a good thing so far.
So far, just human to human.
Yeah.
All right. So would you take roll, please?
Whitlow. Curtis.
Yeah.
Barr.
Yes.
Pokenauer.
Yes.
Doobie.
Yes.
Awful.
Yes. Any public comments? No public. All right. We can have a report, Doctor.
Sure, yeah. So last month we adopted 6 dogs and 2 cats. And one of them we had to put her down because of that severe injury, but she's so super aggressive. And then the other cat, we transferred her to a shelter in Hoopston shelter, which was good. But again, we called a lot of shelters around, they don't accept cats. Because most of them, stray cats, are kind of aggressive, hard to train them to be a good cat. But
So what are you doing with them then?
we have to wait. So far, the deal is by the law, we have to wait for 10 days, watch them. If everything is fine, it's kind of like, county property, like that we can either, I don't know, I'm not allowed, or animal control not allowed to let somebody adopt cats or dogs from our facility. Because of the liability issue, we have to move them to another shelter. And that's what I'm saying, the big challenge. We have to go around, many areas. We have to take pictures, send it to them. We have a very nice cat, and I cannot release a cat or a dog aggressive, because again, this is the liability for the county. They can say, why did you release aggressive cat or dog, and then they can bite people. So after 10 days, we have the option either like to put and this is again in the ordinance for Iroquois County. After 10 days, it's our property, the county property, and either like we put her down or we see somebody to adopt her. But not through us, we have to find another shelter.
Is that what that heart is in Hoopston, is a cat rescue or?
No, they are not a cat rescue. They deal with dogs and cats.
Okay, well, I guess adoption thing. I guess it's
Yeah,
the wrong
yeah.
Terminology, but it was transferred to be adopted.
Right,
Okay,
absolutely.
Okay, so that's what that.
Yeah,
facility
no, they
is.
don't, but yeah.
Okay.
So you transfer them then over to Hoopston? There is a place?
One cat transferred to Hoopston, but we have a shelter once upon a prayer. They're always interested about our dogs. And they always, if you have guys anything, send a picture, we come and pick it up after 10 days. So this is, the dogs are okay. The cats is still a challenge so far. Yeah. And you cannot predict, the behavior of the cat.
Right.
This is the problem. And we are not allowed to treat the cats, because if they have, fleas, okay, we can do that. But if they have worms, eye infection, things like that, we don't have a budget to do that.
I got the state title.
Yeah.
It's every day.
So how many cats have you registered since the last meeting?
Oh, 2. 2 of them so far.
Yeah.
But I just want to mention one more thing. Like, some people, like, they are very kind enough that they catch the cat. They can bring it. They said, this is like, out of the animal control. They said, like, I want you to do castration or spay, whatever, and then they let it loose outside, which is good, so far. So this takes some of the stress or the pressure from the animal control.
Yeah.
But we had a lot of calls as well, like, I have a cat wandering around in my backyard, come and pick it up. Things like, or people like, I have 2 cats or 3 cats, I want to get rid of them, she'll come and pick it up. We don't do that. It's your responsibility. Call your veterinarian and he can deal with that. We have a big discussion with Mr. John and the city attorney about that. Because people make it easy for themselves. They said, okay, take the cats or dogs and put them down, but we cannot do that.
Any questions for Dr. Youssef? Seeing no more questions, we appreciate you being here and thank you much.
Thank you very much. Thank you. Goodness, you're welcome. Thank you.
Okay, I think we've got Dee Schippert with the health department today.
Good morning.
Good morning.
I brought Emily with me today. Emily Shea is the Director of Senior Services for the Health Department. And in a little bit, she'll talk to you about our community care program today. But before we get going on that, I want you to know I did not bring you a grants and contracts listing because it has not changed at all. So, and probably won't change now until the state fiscal year ends in June, at the end of June. So we probably I won't just hand out the same paperwork every month. That's a waste of paper. So before we get started on our summary report of programs, I do want to talk to you a little bit about a program that we're developing at the health department called Hidden in Plain Sight. Hidden in Plain Sight will be a program that we are going to start implementing in the county to help educate parents about what things they can watch for that would indicate possible drug or alcohol use in their children. So Hidden in Plain Sight is going to be basically it'll be a mobile bedroom that we take around, and we're going to do this we're offering it to all the schools in Iroquois County. And we're kicking off our program on April 6th at Watsiki Community High School, and we're partnering with a lot of area agencies. I'm not even going to try to list them all because there are so many. But what we're going to do is have a program that evening. We're going to have a panel discussion. We'll invite parents in. They will walk onto the stage at Watsiki Community High School up one side, and they will be able to observe what looks like a teenager's bedroom. And inside that bedroom will be anywhere from 50 to 80 different objects that look like normal, average, everyday things you would find in a teenager's room, but are things that can be used to hide drugs or alcohol. And we'll let the parents walk through that, look through the bedroom, see if they can identify things that might indicate that. And then the high school is going to provide a meal for them, hot dogs, and the hospital is going to provide chips, and we're going to provide water. And this will be a program for parents only. We're not going to allow any students in because we can have a how-to hide it from your parents session, right? We
What
don't want
time
them.
is this?
This will be starting, the doors will open at 5:30 on April 6th. And then we'll have a panel discussion. So the actual doors will open and people will be able to walk through from 5:30 to 6. And then at 6 o'clock, we'll start a presentation. We don't want this to be a long evening. We want the whole evening to be like less than an hour and a half, because after that you start losing people, you know. But what we'll do is we'll have a PowerPoint that shows all of with a big screen set up in the gym, that will show all the items that were in that bedroom and how teens use those things. For example, power strips that have a hidden compartment in them. They're actually working power strips, but they have a hidden compartment. A weighted soda pop can. It looks and feels exactly like a soda pop can. You cannot tell the difference. But up underneath is a hidden compartment. Things like that. Most of these things are purchased, the kids can purchase them off of Amazon. The health department did receive a very generous donation from Green Galvanized Stairs, so that we're going to use that donation money. They donated $2,000 to our program. We're going to use that to purchase things off of Amazon that the kids are purchasing. We're working closely with the Watsiki Police Department. They're telling us what they're finding, you know, when they're confiscating items out of cars or whatever. They're going to provide some of the confiscated items to us to use through a mutual joint agreement. But we are going to be purchasing a lot of this stuff. I already prepared the Board of Health to be prepared that on the next claim, probably not this month, but next month, they're going to see purchase items that might even be considered drug paraphernalia that we need to use in our program, but to be prepared for that. So I'm going to purchase those under my name so that none of my staff is so we don't have all these claims coming in from different people ordering things. It'll all be under my name and will be my reimbursement then. But and I'll upfront the money for that. But this should be a really good educational program for parents to help them identify if their child potentially has a problem. Because we know that, especially with people who have problems with drugs and alcohol, if you can catch them early on, they have a much better success rate of not becoming so addicted that it takes multiple times in rehab to get it cleared up. So we're hoping that this is something that parents want to learn about. But we'll be offering this program to every school in the county. I've even offered to loan our supplies and our program things to other agencies to use. We don't have to be the owner of everything. We want this to go. IMH is interested in taking it over, for some of their programs. So we'll definitely loan it out. As long as people are learning, we want this to be a successful program that teaches parents. I learned a lot when I went through the program. We're replicating the program from Putnam Bureau County. They've been doing this for quite a while. They have a mobile trailer that they actually set up as a bedroom and take it around. We're probably, at this point in time, we're not doing the trailer just because the trailer limits you if you have bad weather, or it's cold or it's too hot in the summer or whatever. So we're going to be just taking the equipment. But we hope that this is going to be a good educational program for our community and might change some lives.
Now, are we able to come to this? Or
Yeah,
is it
it'll be
just
open to
parents?
it'll be open to the public, but you have to be a parent to come. We definitely don't want high school age kids or below coming into this. We don't want them to get ideas.
Yeah.
Are you gonna do all the high schools like within a short amount of time? Or
Yeah.
are you spreading it out?
We're
or-
trying, we're rolling this out now. We're gonna try to get all the high schools in the county done in April and May.
Now, are you advertising or what?
Yeah,
That was
we're
my
gonna blow
question.
this up with social media. The hospital's partnering with us for this. Lots of different community organizations are partnering with us. Like I said, I'm not gonna try to go down the list, I'll forget somebody. But so we're gonna have tables at every school event too that are resources. We don't want to just show parents and then say, here's what to look for, without giving them resources if they find this. So we'll have lots of organizations that have resources, and we'll also have on a sheet of paper where they can list when they go through the mobile bedroom, where they can list the things that they might identify. On the back will be a big list of community resources, where to reach out for help if you have if you suspect that your child is using and you're concerned. One of our big partners is Kankakee County Health Department, because they have our opioid grant. They're the lead agency, and we're subcontracted under them for like Narcan distribution and all that kind of stuff. But they have Lindsay Wilson and Brady Bellin are their people who are working with Iroquois County with us with this, and they've come for 4 or 5 meetings on this Hidden in Plain Sight and offered great resources and great help, and it should be a really nice program.
Oh, I love that.
It should be a really nice program.
Yes.
So we hope to get that rolled out. We can have it ready to go as early as March, but we hope to have it start rolling it out, make the Watsika event our first one. And then if parents from other towns can't come on the dates where it's listed, they're certainly welcome to come to a different, school to see it too. But yeah, it'll be open to the public, adults only. And the Watsika High School, some of the student groups, National Honor Society, Student Council, Key Club, have offered to do some babysitting. So if parents need a sitter, and they're, like I said, provide hot dogs and chips and all that fun stuff. So it should be a nice event. And by doing it early in the evening, we can have people home by 7 o'clock at the latest. So it should be a nice event.
Yes.
Okay. Yeah, I just wanted to make you aware of that, that's one of the things we're working on really hard right now. Besides all of the coronavirus, CDC conference calls and IDPH conference calls that we're doing.
I get a coronavirus sometimes.
Yeah.
It's got a line in it.
Yeah, I have this one, right? Ha, ha, ha. Oh,
Aren't
you're
you
so
funny?
witty.
It's okay, we need that humor.
I get a Buck Ultra one too. once in a while.
Here, let me give one of these to Martin.
Chinese.
So, on our summary report of programs, you can see, we still left the fiscal year 18 and 19 year-end stats so that you can kind of look and see what our year-end stats were for the last couple of years. But as we go along, we'll be filling up all the columns with the month's data. You can, they're pretty self-explanatory. If there's anything you want me to go over with you, I certainly will.
The food sanitation inspections were nil.
Yeah, we don't do a lot in December.
Okay.
We, so, yeah, that's a really good question, Roger, so that you guys can understand. We keep December kind of set aside for those restaurants that need a third inspection or need a re-inspection. Otherwise, January through November, we're doing our regular inspections, but December kind of gets held aside for that purpose. Just so that we can make sure we get all of our cleanup for the year done.
Syphilis looks like it's rearing its head.
Okay, so I knew that would come up. Hepatitis C and syphilis, we knew would come up. So just so that you, yeah, it is.
And far back do you, how far back do you go and how many did you have to check with on?
Okay, so
Regarding those three.
Okay, so let me explain this to you. So if you look at those 3 syphilis cases and the 8 hepatitis C cases, I want you to know that 5 out of those 8 hepatitis C cases and all 3 syphilis cases were actually people who were residing in Iroquois County at Banyan.
That's one.
At Banyan.
Oh,
And they're not actually Iroquois County residents. So once we start the investigation, then when those people are out of the Banyan Treatment Center and go back to their counties, we transfer those cases back to their home county. So I wanted to make that, point that out to you.
so you'd still have to follow up on the contacts in the county.
Yes, if they're residing in the county, we still follow up on it. But once they go back to their home county, that case gets transferred to their home county for a follow-up. So I wanted you to know that. But yeah, STDs are on the rise. We know that. We do. We've been doing some extra STD talks in the county schools as well. Actually, I've been doing some of those. I kind of enjoy talking about that. I do.
Okay. Whatever.
Yeah. So other than that, just the average stats for our programs.
Vision screening, that seems to be fairly high.
Yeah, we, do vision screenings on all the county school kids, in specific age groups. So vision has its age groups that have to be screened, and hearing has its age groups that has to be screened, and we provide those.
Okay.
A lot of times we don't do a lot in December because we call the schools, and in December, they're having holiday parties and finishing up the semester, and they're out for a while for holiday break. So we tend to avoid the December ones, but they'll pick back up in January like we always do.
Yeah.
February, March, April. Then in the summer, they slow down again a lot too. In the summertime, we just do the preschools and head starts and stuff like that. Any questions about our summary report programs? Okay, then I'm gonna turn it over to Emily. She's gonna she didn't bring me notes or PowerPoint. She's just gonna talk to you guys a little bit about our community care programs. Oh, did you?
Oh, and if I can get myself straight.
Okay.
So, like Dee said, my name is Emily Shea. I'm the new Director of Senior Services. Just wanted to say I didn't know anything about this program when it started. I've learned it from the bottom up. Saying that, I just want to emphasize how important this program is because I think I kind of call it Iroquois County's best kept secret. I don't think a lot of people know about it, which I'd like to remedy. It serves a population that is underserved. Iroquois County, I think, has their population is 20% is 65 or older. The state average is 14.6.
Yeah.
So, and we serve all of Iroquois County. As you know, Iroquois County is a large county. There's 3 of us. There's myself, Kelly Ward and Caleb Parker. They're both working on their education as we speak. And with that being said, we'll talk a little bit about the community care program. So we are under the direction of the Illinois Department on Aging. We have continuing training. We have to be certified in this. I had to go to Springfield for 3 days and learn about the program. So what we do, our biggest goal is to keep elderly seniors in the community for as long as possible, to try to keep them out of nursing homes. And we do that by finding resources for them. We can refer them to resources. Sometimes we don't know and we just go on a hunt and we just look and see what we can find to help these people. What I see here specifically in this county is we have a lot of elderly folks who are poor.
Yeah.
They just don't have
Financially strapped.
Yes, they live Social Security check from Social Security check. I see that a lot. They just don't have a lot of family. That's another big problem is they just don't have a lot of outside help from family. So our little program gets to come in and help with that. We have 4 major providers that we refer to. The 2 big ones we use most are in-home services, which is basically like volunteer services, has homemakers that go into people's homes. They can cook for them, clean for them, do laundry, they can run errands, they can help them go to their doctor's appointments. They can also do things like bathing, dressing, grooming, those kinds of things. That's the most popular one we use. That's the one I find in this community that is readily available, number one, and the most needed. The second most popular one is it's called the Emergency Home Response System, which is the emergency button, like the I've fallen and I can't get up button. So we can provide that for them as well. We have several providers for that. They choose which one they want, and we refer them, and the company comes, sets it up, and monitors it for them. Also with that, the company will notify us if they press their button. So we do a lot of follow-up with people who, if they press their button, we call them and see, did you go to the hospital? What happened? Blah, blah, blah. So we can follow up with them later on as well. The 2 we don't use as much is the automated medication dispensers. It's basically what it sounds like. It's electronic. It's a system that will alert them that it's time to take their medicine. Sometimes they have a drawer that pops open, an alarm that goes off to remind them because they forget their medications.
I could use that now.
The only problem we're finding with that, this is somewhat new. This is newer to the pro. Yeah, you're not there yet.
It's gotta be getting
We'll get
close.
there. We'll explain then you'll know. So the problem with this is that Of course, if they're forgetting their medications, they can't set the system up themselves. They've got to have a family member or a close friend that can set this up for them, because their homemakers cannot do that. The homemakers can't administer it, they can't set up their medications, they can remind them to take them, but that is it. So that's the problem we're finding, is that they've got to have somebody to set that up for them. So we don't use that one very much. The least used one we see is the adult day service, which is a facility that is outside their home where an elderly person can go for the day. If they're, if they can't be home by themselves and they don't have family to be with them, they can go to this adult day service. They get meals, there's a nurse there, they administer medications, all those kinds of things all day long. We don't use this one because the closest one is in Kankakee. There's not one closer. It's a lovely place, I've been there, but the transportation is an issue. From what I've learned, they've tried to work with the show bus, it didn't work. And that particular adult day service only will transport in Kankakee County, they don't come down to Iroquois County, so unless you have a way to get them up there and get them home, it just doesn't work. So the eligibility requirements for this are, you have to be 60 years of age or older. Yes.
Keep going.
A U.S. citizen, a resident of Illinois, and then there's financial eligibility requirements as well. This is where it gets a little sticky. But the easiest way to explain this is what this program considers non-exempt assets. So non-exempt assets to this program would be money that is readily available to you at any time. So cash on hand, savings and checking accounts. If you have a whole life insurance policy that you could draw from, trusts, stocks, bonds, CDs, those kinds of things. You cannot exceed $17,500. So we find if somebody is over that limit, there are some resources for them as well. We try to point them in the right direction and help them out with that if they are over the eligibility limit for financial stuff. So that's the one that always gets everybody. You start to mention that and they're like, yeah, I got more than that. So, but we do have resources for them as well. So that is our little program.
You do have resources for the people who
Yes, the only thing-
17,500?
What happens is when you get past that point, the state will pay. See, this program is free.
I deal with it every day.
Yeah.
I work in a nursing home, so
Okay.
I get it.
Yeah.
So you say you do have services.
But they have to be private pay.
Okay. Just
Yeah.
asking.
We do, we have,
What services do you offer if it's over 17,500?
well, nothing for free, so they wouldn't qualify for this
Oh,
program.
okay.
But I can say,
Gotcha.
I have a list of private pay
Gotcha,
homemakers that could come in your home.
gotcha.
I just sent a lady a list of all the emergency button companies that we are contracted with, just so she knows, we use them, they're good, they have a good track record, so I can send them that.
Good.
And then we also have, we can also refer to the Illinois Voluntary Money Management, which you don't have to be on this program to qualify for that, kind of a standalone program, but we can refer to it. So these are people, literally volunteers who come into, a senior's home and help them with a budget, with paying bills, checking accounts, and, keeping all of that straight. And then there's also the Senior Companion Program. That is basically what it sounds like. It's just another senior who volunteers their time, and just to go sit with them. They can also help with transportation. They can, cook a light meal, do a little light housework as well.
But they have to be at home to qualify for those services.
So it just,
It's very interesting.
it's something to keep in mind if
No,
you,
because I talk to people all the time, and I can't do it in the nursing home, but if they come up to me and say, hey, you work at, are there other services?
you just give me a call.
Yeah, I know, just the person you need to go talk to.
Yes,
Yeah.
they need to call here and ask for senior services, because we have a lot of things that we can help people with. even if they don't meet the criteria, we can steer them in the right direction at least.
Yeah.
With this in mind. I love this little program. I do. It's great.
How many people know about it?
That, I know, I'm gonna remedy that, I gotta get some more, I gotta get my feet under me just a little bit more, so.
Well, thank you.
Yeah, it's very informative. We faced it with my step grandpa.
I feel like everybody has
He
somebody.
had no idea,
Right.
you know, and his kids were far away
Mm-hmm.
and mom and I didn't even know who to tell them to call and try to.
Right. Spread the word, I'm gonna be out there trying to spread the word as well.
Your last name is-
Shay, S-H-A-Y.
She's nice, her husband's this good.
Tell me about it, I gotta
I
look
work with him. He was the only officer.
You didn't even know that? No.
No.
You don't know about Emily.
That's why I said she was alright. He's a little, and I'm kidding.
So, Dee, do you have any more reporting?
That's it for today.
I don't
All right.
care.
Well, we appreciate you two coming in and.
Thank
giving
you.
your report. Thank you much.
You guys have a great day.
You're welcome. I'll tell Eric I saw you today.
Yeah, and you can say that, I mean, he would expect nothing less for me to make a crack about it.
So you guys liked the list that Eric handed out for you last time when I couldn't be here?
That'll work.
I need that one.
Yeah,
I
you
need
want a
it.
copy of it? Sure, I'll go get you one.
All right.
I'll bring it back down to it.
Thanks, guys.
But yeah, well, anything on that list that you want changed around, if you want a different topic, just let us know.
Look good, Dee.
You guys didn't get a list.
We
did
didn't,
you?
yeah, we
Because
both
you were
missed.
I'll
gone
bring
last
those. In fact, I'll just go get them now.
Okay, cool, thank you.
All right, thank you. So, have we got any old business today? New business?
So
Nope.
made. True.
All right, so can we have a motion to adjourn?
So
And
moved.
she made it. Second, all in favor, say aye.
Aye.
Opposed? We are adjourned